Thank you for joining our Debbie's Dream Foundation Curing Stomach Cancer webinar on the role of nutrition for cancer patients. When diagnosed with cancer, nutrition becomes even more important. Good nutrition can help you feel better, reduce the risk of infection, keep your strength up, and help you heal faster. During this informational webinar, you will learn about the building blocks of a healthy diet as well as the nutritional needs throughout treatment. I am Mary Margaret Kilmeyer, and I will be moderating today's webinar. I'm the Patient Resource Manager for Debbie's Dream Foundation Curing Stomach Cancer. I'm a licensed marriage and family therapist and currently completing my doctorate. My clinical and research background is focused on working collaboratively with doctors, patients, their families, and members of a healthcare team. We would like to thank Genentech for providing funding to make this webinar possible. We would also like to thank our promotional partners, the American Association for Cancer Research, the Anti-Cancer Club, Cure Magazine, the Esophageal Cancer Action Network, Meals to Heal, and Patient Resource. You will be able to ask questions during this presentation. You can type your question into the white text box that appears on your screen. At the conclusion of the presentation, we will address questions as time allows. If we do not have time to address your question, we will try to address it during the next webinar taking place on April 1st at 12 noon Eastern Time. In addition, the recording of this webinar will be accessible on our website in approximately 1 week. Now I will introduce Debbie Zellman, who will share with you her journey and information about Debbie's Dream Foundation. Then Rachel Wong will present the role of nutrition for cancer patients. And then there will be time for a question and answer session at the end. I would now like to introduce the president and founder of Debbie's Dream Foundation, Debbie Zellman.
Thank you, Mary Margaret, and welcome everyone. It's a pleasure to be with you all today. In April of 2008, I was diagnosed with stage 4 stomach cancer. I was only 40 years old, the mother of 3 young children, married to a physician, and I was a practicing attorney with my own firm. I had no risk factors for stomach cancer, and my symptoms were all very vague. As I soon found out, my chances of being alive in 5 years was only 4%. I'm happy to tell you, however, that in April of this year, it will be my 7-year anniversary. In April of 2009, I founded Debbie's Dream Foundation Curing Stomach Cancer. I am currently still a cancer patient, though. I am on Herceptin by IV every 3 weeks, and I take an oral chemo called Tykerb every night. My involvement as a patient advocate extends to serving on the NCI Esophagogastric Task Force, on the NCCN Gastric and Esophageal Guidelines Committee, to the Department of Defense Peer Review Cancer Research Program Integration Panel, to the ASCO HER2 Testing and Gastric Cancer Project, and most recently as an NCI Patient Advocacy Steering Committee member. The Foundation is also a member of the Deadliest Cancers Coalition, the Patient Equal Access Coalition, and the State Patient Equal Access Coalition, as well as One Voice Against Cancer. However, after all of those things I've articulated, people tell me my most notable achievement is that I've appeared on an episode of Dr. Oz, and the episode was about stomach cancer. Next slide, please. So here are the facts. Stomach cancer is one of the leading causes of cancer death worldwide, second in men and fourth in women. Most people don't realize that. Each year, almost 1 million people worldwide will be diagnosed with stomach cancer, and approximately 700,000 will die. More than 24,000 Americans are projected in 2015 to be diagnosed with stomach cancer, and more than 11,000 will die. Stomach cancer in the U.S. is on the rise in young people ages 25 to 39, another fact that is not very well known and is scary. However, per cancer death, stomach cancer in the U.S. receives the least amount of federal research funding of any cancer. In addition, there are few resources and support services for stomach cancer patients, and most people still know very little about the disease. Next slide, please. So, Debbie's Dream Foundation, Curing Stomach Cancer. We have an extensive mission because there's so much to be done for stomach cancer. We raise awareness about stomach cancer. We advance research funding for stomach cancer, both by advocacy and by directly funding research grants. In addition, we provide education and support internationally for patients, families, and caregivers, and those are all free services that we provide. DDF's ultimate goal is to seek the cure for stomach cancer and to make it a reality someday. Please do check out our website at www.debusdream.org. Next slide, please. I'm happy to tell you that in April, as an organization, we'll be reaching 6 years. And in that very short time frame, we've reached a lot of milestones. We have an amazing website that I just gave you, which contains in-depth stomach cancer information, a lecture library. So for example, this lecture, after it's given, will be housed on the website, and every lecture that we've ever had is housed there. We have a lot of clinical trial information as well as a free matching service. We have a one-of-a-kind stomach cancer support community, a blog, and many other resources. And they're all translatable into 60 languages by simply clicking at the bottom of the website. We have a free patient resource education program helping hundreds of patients, families, and caregivers throughout the world. We match the inquirers with other survivors or caregivers using very specific disease criteria, including stage and biomarker. We have, like I said, free stomach cancer education symposia and webinars throughout the year. We have 24 chapters in the US, Canada, and Germany, with more chapters coming every day. We have events across the US. We've funded $150,000 in research grant funding. We've held 3 stomach cancer Capitol Hill advocacy days and the first ever Capitol Hill briefing. And we were successful last year in our advocacy efforts that we were able to have stomach cancer included for the first time ever in the Department of Defense peer-reviewed cancer research program, which is a $50 million pot of money that will go to cancer research. Next slide. So here's just a quick little view of our website. It's a very user-friendly website, but if, of course, you ever have any questions, please just contact us. And now I'm going to turn over the presentation back to our presenter, Mary Margaret Kilmeyer. Thank you so much.
Thank you, Debbie. As you can see on the screen, we have several events coming up that we participate in. This week, we will be having a booth at the NCCN 20th Annual Conference located in Hollywood, Florida. Our organization will be recognized in Cleveland, Ohio on April 2nd during the Cleveland Cavaliers game against the Miami Heat. Coming up on April 18th, we will have our Stomach Cancer Symposium and Dream Makers Gala. The symposium is a wonderful educational event for patients, family members, and caregivers, and as well as care professionals who are interested in learning more about stomach cancer. November 11th is the International Stomach Cancer Genes Day, and in 2016 we will be participating with a dream team in the Miami Marathon and Half Marathon. Debbie's Dream Foundation is headquartered in Davie, Florida. Our office is open from 8 a.m. to 5 p.m. Monday through Friday. On this slide, you will also see important phone numbers and email addresses to contact our office. We will start the presentation on the role of nutrition for the cancer patient. Our presenter is Rachel Wong. Rachel is a registered dietitian and board-certified specialist in oncology nutrition. She currently works as the outpatient oncology dietitian at Medstar, Georgetown University Hospital, Lombardi Comprehensive Cancer Center. Rachel has 6 years of clinical experience with adult oncology, adult and pediatric survivorship, critical care, wound care, rehabilitation, and neurological disorders. She leads the patient-centered support groups and has presented at conferences in the Washington, D.C. area. At this time, I will now turn over the webinar to Rachel Wong.
Thank you, Mary, and thank you, Debbie, for both having me here to present today. I'm happy to talk with you about nutrition and give you some information regarding the role of nutrition and how it can affect the individual's cancer care experience. Next slide, please. So I'm going to give you some information on how nutrition can affect your cancer care from the time of diagnosis through till survivorship, and also give you some information on managing symptoms from treatment, as well as discuss some common myths that are often brought up to me. Next slide, please. So nutrition plays an important role across the spectrum of cancer care. As I had said, from the time of diagnosis through survivorship, proper nutrition can help manage acute side effects from treatment, from chemotherapy, radiation, and help to preserve nutrition stores. Nutrition can also play an important role in helping to recover from treatment and help manage lingering side effects. Next slide. Individuals with weight loss and poor nutrition during treatment have found to have reduced therapy doses or shortened therapies, which can also result in reduced positive outcomes from the treatment. So trying to have the best nutrition possible during treatment is optimal, and working with your dietitian is key. As you can see, with poor nutrition, there has been studies shown to have the individuals have shorter overall survivals, decreased quality of life, decreased poor performance status, and for those who have improved nutrition during their treatment as best as possible, even if it occurs midway through treatment, better overall survival has been noted. Next slide. Some important considerations to take into account is that during cancer treatment and with the cancer itself, it can change the nutritional requirements of an individual, causing impaired intake, digestion, absorption, and utilization of food. Cancer can give off hormones and other chemicals that can decrease appetite and increase your metabolic requirements. Thus, you may find that even though you're eating the same amount that you normally do, you may find that you're losing weight. So again, here, this is a good time to adjust with your dietitian, your concerns with your dietitian, to assess what your nutritional requirements are. You may notice, in addition to fluctuations in your weight, difficulties with eating, fatigue, and motivation that can also impair an individual's weight. Next slide. So your goals of nutrition will be to, most importantly, maintain your weight by preserving your body nutrition stores, especially your lean body mass, your muscle. And there we emphasize your intake on protein, which will be discussed later on, as well as consuming adequate macro and micronutrients, such as your carbohydrates, proteins, and fats, and also the vitamins and minerals your body requires to optimize your nutritional status. Your other goals will be to maximize quality of life and reduce the risk of cancer recurrence metastases after treatment. Next slide. So now I would like to discuss with you some common symptoms that arise during the treatment of cancer patients with gastric cancer. These are some of the symptoms that we commonly see, and so I will address some of them individually. Next slide. Early satiety is one of the first symptoms that I often observe, and so some of the recommendations I do provide for my patients include, first and foremost, to start with consuming smaller, more frequent meals. For example, eating a smaller breakfast, then consuming a mid-morning snack, a lunch, a mid-afternoon snack, and a dinner, and then a late evening snack. Oftentimes I'll suggest also to try like a nutrition shake between your meals, which can be a little bit easier than thinking about eating another small cooked up dinner. It is important to eat slowly for at least about 20 minutes, and also to be aware of not drinking too many fluids while you're eating, as those can fill you up and make you full more quickly. Foods with high amounts of fat, fried foods or high-fat meats, can also take longer for the digestion to occur. So it is important to make sure that you moderate those kinds of foods and make sure you try to choose leaner proteins like chicken or fish to help get the adequate amounts of protein your body requires. It also may help, as I said earlier, about liquid intake, is to try to separate your liquid intake before or even better after you eat. One more tip here is to also try to consume your protein foods first, part of the meal if you are feeling that you're getting too full to eat your whole meal. That way you get at least the lean protein from that meal. Next slide. Further symptoms that are observed is poor appetite and taste changes. And similarly, we do also recommend that you consume smaller, more frequent meals, and even more importantly, to hydrate well. The first thing that I do recognize with a lot of my patients is that their hydration status is poor. Maybe they are consuming 8 or 16 ounces of water, or not even maybe juice a day. Water plays a very important role in taste perception. So if you're dehydrated, I always recommend that that is the first thing that you must pay attention to. And aside from improving taste, it will help improve energy levels and also improve your ability to use the restroom, have bowel movements, for example. So 54 ounces a day is equivalent to 8 cups of water, 8-ounce cups of water, or if you recognize it by the 16-ounce, for example, Poland Spring water bottle, that's about 4 of those bottles a day. So if you can separate that out and carry a water bottle with you daily, that will help you meet your hydration goals. It is important to also schedule your meals and snacks throughout the day. Oftentimes when you're coming for treatment, especially if your treatment occurs early in the morning, a lot of individuals do forget to pack food or find that they don't have enough time to make themselves breakfast or make themselves some snacks to bring. But simple snacks that are easy to take on the way include peanut butter with crackers, or you can make maybe like a tuna salad or egg salad the night before, and you can bring it in a take-home container, and you can bring that with you. Or even an Ensure, if appropriate, or a container of yogurt or cottage cheese. Those are all high protein sources that are that are portable, easy to carry. So those kinds of snacks are important to bring. So it is important not to skip a mealtime, even if you're running on the go. So pack the night before if possible. Proper oral care is important, especially with managing taste changes. So we sometimes actually recommend that you wash your mouth or brush your teeth more than just twice a day. Sometimes before and after meals can help. If you're noticing a metallic taste in your mouth, you can try to use more plastic cutlery instead of metal. And also to take note of certain flavors of foods and certain foods that can enhance the flavors. And here's why I bring up fats. It's the fats, acid, salty, and sweet. And a lot of these flavors can be enhanced. So if you're noticing taste changes, experiment with these different flavors and foods and see what works for you. Everybody experiences different taste changes, and some people notice that things are too salty or sweet or sour, so try different foods on the other spectrum. Next slide. As noted before, weight loss can occur because of hormonal changes from the cancer alone and from the treatment itself. And it is very, very important to make sure to maintain your weight, especially your lean body mass. And so here the theme about eating smaller, more frequent meals comes up again as is key with most of the symptom management here, recommendations here. So other ways to increase your calorie intake and protein intake, aside from eating more smaller, frequent meals, is to try to choose more calorie-dense and protein-dense foods. And what I mean by that is, for example, if you have oatmeal in the morning, instead of making it with just water, you can add an extra 130 to 160 calories by making it with milk and possibly adding some nuts or walnuts. A handful is almost 200 calories, and maybe some raisins as tolerated. And I even have some people adding some peanut butter to their oatmeal, and that can also add another 100 or 200 calories. So instead of just a plain bowl of oatmeal that would normally be about 160 calories, you can make a very fortified oatmeal that can be closer to 300 to 400 calories, the same volume. So that is some suggestions on fortifying your foods. Adding sauces, adding extra sides like nuts or seeds or granola can really help. You can also use some supplements, and you should discuss this with your dietitian prior to starting, but there's a lot of over-the-counter things such as Ensure, Boost. Orgain is the organic, one of the organic products that I like to encourage. It's a little bit less sweet in flavor, which some patients like, and it also still has about 16 grams of protein, 260 calories. Other formulas are like carnation instant breakfast and boost very high calorie, which is a 540 calorie supplement. Again, these supplements can be encouraged as long as you discuss with your healthcare team and your dietitian. Next slide. So here's a list of foods, just for your, I won't go through each one, but just so you have an idea of what kinds of things you can do to add and fortify your foods, or just to choose higher calorie, higher protein foods. And so you can see just a couple of things: nut butters, whole milk, avocados. A whole avocado can be up to 400 calories or more, so even having half is a good 200-calorie snack you could add to a sandwich, or add to a salad, or even add to smoothies. A lot of times you can make those green smoothies with avocado included. Next slide. Nausea and vomiting can also be a very prominent symptom from chemotherapy treatments or from radiation as well. So it is important to eat slowly and eat in small amounts. The small frequent meal recommendation also applies here. Sitting upright is key, and I do encourage individuals to sit upright for at least 30 to 45 minutes following a meal or small meal instead of lying down right away. It is also important and helpful to eat in a calm environment and relax, so try to reduce the noise and also reduce if there's any children running around or if there are lots of sounds or cars. Reduce the sound in the room and make it a peaceful environment so you can focus on the meal and enjoy the food as best you can without too many distractions. Next slide. And following here is another list for you guys to look at in terms of what foods we tend to recommend, and also on the right foods that you can also avoid when you're feeling nauseous or having any vomiting. You can see a common trend with these foods that the foods that are recommended are low residue and low in fiber, so they're easy to digest, like potatoes and rice. You can also do things like rice checks. Rice-based cereals tend to be easily tolerated. So with patients that have had severe nausea and vomiting, I'll encourage just to bring little snack bags of pretzels or rice checks with them so that they can nibble throughout the day, because at least that will help them get some of the carbohydrates and calories in small amounts. Foods that can be more worrisome or causing nausea or vomiting can include fried foods, greasy like hamburgers, and fried fish, French fries. Also, sometimes very sweet foods can be triggersome for others. Spicy and hot foods can also be poorly tolerated, and foods that have a strong odor, and also even perfumes and colognes. So encouraging family members to not wear colognes or perfumes can actually help with nausea and vomiting. Next slide. Mouth sores is another common symptom, and what we encourage here, as I had partly discussed earlier, is having optimal oral care. Brushing your teeth and tongue with a soft bristled toothbrush is helpful. Avoiding alcohol-containing mouth rinses, and you might not even want to try, this is a common recommended mouth rinse. It's a mixture of a cup of warm water, a quarter teaspoon of baking soda, and an eighth teaspoon of salt. And you can also use a straw to divert liquids, and it is recommended to avoid any acidic or rough textured foods like toast or hard pretzels. May not be the best choice. Maybe soups tend to be more tolerable, so I'll often encourage more cream-based soups, maybe like a pureed. You can also do like a clam chowder or a lobster bisque, or foods like that. Next slide. Indigestion can occur often from radiation treatment or from if you've possibly had surgery, and so it's helpful to avoid any acidic foods such as lemons and limes, oranges and pineapples, and tomato products. Again, the common topic of avoiding greasy fried foods is here, and eating slowly is key, again, over a period of 20 minutes or longer. It is helpful to consume liquids separate from your solid food intake, so likely eat and then wait about 20 minutes or so before you try to drink some liquids. That way that doesn't expand the food in your stomach and make you full faster. Avoid eating 2 hours before going to bed, and also sit upright for a while or walk after you eat, which can help with the digestion. Smaller, more frequent meals is also recommended, and oftentimes caffeine can be a trigger as well, so Sometimes I do recommend to avoid caffeinated beverages if you're experiencing lots of indigestion. Next slide. Diarrhea is also another common symptom. I'm going to talk about diarrhea and constipation here as the last two symptoms. But diarrhea recommendations for symptom management include limiting your concentrated sweets, such as juice and candies and cakes. You can try to dilute them too. Sometimes the sweets can really contribute to the loose bowel movements. It is important to drink fluids frequently if you're having multiple bouts of diarrhea, especially 30 to 60 minutes after your meals. Proteins don't normally tend to contribute to diarrhea and can help slow the digestion of food. So lean proteins like chicken or fish might be helpful to eat with your meals, along with maybe some lower fiber like rice, white rice or potatoes with the meal, and maybe some carrots, steamed carrots. Sometimes dairy products, especially those with lactose in them, can exacerbate the diarrhea. Even if you may not be lactose intolerant, you can temporarily become. And so to help reduce any of the possibilities of lactose causing diarrhea or contributing, you can reduce that, limit your intake of those, and choose lactose-free milk or soy milk as another option. If the diarrhea becomes excessive and you're having more than, let's say, more than 10 bowel movements or more, you may want to discuss, you should discuss with your doctor other causes of the diarrhea, especially if it lasts for much longer after the treatment. Next slide. Here's a list of foods for you that will also be useful if you're having diarrhea. They are similar to the other lists you've seen, but lower residue foods are helpful in this situation. Choosing white bread or smooth peanut butter. You want to avoid any foods that have insoluble fiber that won't digest as quickly. Again, this is helpful for those with diarrhea, but it is also important to also figure out what is causing the diarrhea if it is an ongoing cause. So that's something you can talk to your doctor about. Things we recommend to avoid include eating raw vegetables, fruit with seeds, skins, or stringy fibers like celery or blackberries, because the seeds are not very digestible. And other foods that are very gas-causing or high in fiber like broccoli, corn, Brussels sprouts, cauliflower, cabbage, and peas are not recommended, and as I said earlier, avoiding lactose. You can find ice cream that comes without lactose. You'd have to just find it in the ice cream section. Next slide. Further on, the last symptom that I want to address is constipation, and here's where food plays a big role. As I had mentioned earlier, that it is important with managing taste changes. It is very helpful and useful in helping keep your body regular and help you from becoming very constipated. You can try choosing more warmer foods or hot liquids to help with the peristalsis or moving through foods through your body. And here's where you would want to typically try to choose more fibrous foods from your whole grains and from your vegetables to help you with keeping a regular bowel pattern. If you're really constipated, sometimes it isn't more useful if you talk with your doctor about medication management, especially if you've already tried the dietary approach. And once you've established a bowel movement, you can start to incorporate more fiber into your diet slowly. One important note here is that as you can increase your fiber intake, fluid is very, very key. If you are not able to drink enough fluid, you can cause more gas, more GI discomfort with fiber intake if you're not drinking enough water. So at least 6 to 8 ounces of water with each time you're eating foods with high fiber content. Increasing your physical activity can help, and also trying natural laxatives such as prune juice. There's a tea, you can also discuss this with your dietitian or doctor. It's called Smooth Move, made from natural senna leaves that can help with going to the bathroom. And lastly, probiotics. We usually recommend that you can consume probiotics from food sources like yogurt or kefir. There are probiotic supplements. Those can be discussed with your dietitian if you're interested in taking them. Next slide. So stomach cancer can have lots of nutrition implications, especially for those who have had stomach resection, total or partial. And even if you haven't, it is important to make note of these nutrients: calcium, vitamin A, D, E, and K, vitamin B12, iron, folate, and zinc. They tend to have poor absorption, especially if you've had the surgery. So talking with your doctor to have these levels checked can be helpful to know if you need to have some supplements. These nutrients all can come from food sources. For example, vitamin B12 can be found in fish such as salmon, oysters, and crab, and folate can be found in dark leafy greens, avocados, peas, and lentils. So as long as if you feel that your diet is balanced, you may be able to be getting all the nutrients you need. But if you feel that you've been unable to maintain your weight and you've been losing a significant amount, you can talk with your doctor about doing some blood tests to assess or evaluate if you're deficient in any of these nutrients. Next slide. And as a further note here, I'll talk about supplements, but we don't recommend that you buy or start supplementing with any extra vitamins or minerals unless you talk with your doctor or dietitian. Sometimes these can interfere with the treatments and cause unneeded side effects. Some of the vitamins themselves can have toxic effects if you're taking too high of a dose. Some vitamins can also have antioxidant effects, which can also interfere with cancer treatments that are trying to work against the cancer cells in your body. So again, I reiterate talking with your doctor about what's appropriate. And if you do take a multivitamin, I get asked a question a lot. It is okay to take a generic multivitamin like Symptom, as long as most of the nutrients the components added are about 100% of your daily value or less. Although most people who do take vitamins often are eating well from the start. Next slide. So a few minutes left, and I just want to go over a couple questions or a couple points that I always get asked from my patients here. And the first and foremost thing that comes to attention is the concept of that sugar feeds cancer. And I want to clarify that there's no known research that has shown that consuming foods that have sugar in them will cause cancer growth or will make the cancer worse. Your body consists of healthy cells as well as cancerous cells, and your body also requires sugar or glucose as your primary source of energy. So restricting that can cause you to feel very fatigued and will starve your body. And in some cases, I've seen individuals who have gone to the extreme and lost a significant amount of weight, which has negatively impacted their treatment, which is why it is key to more so choose foods that have carbohydrates that are more nutritious, like brown rice or quinoa, lentils, but allow yourself to enjoy food too. Again, if you're having a cookie occasionally or some cake once in a while or ice cream once in a while, these things will not be much of a concern. It's more of an issue if you're eating them and they cause you to gain weight. If you're consuming very large amounts very frequently of these non-nutritious foods, excess weight gain and obesity is associated with an increased risk of developing several types of cancer. Another question that brought to my attention often is if individuals need to avoid dairy because of the hormone content. Again, here, there's also no research that shows that, and you can find a lot of the information more with naturopathic and homeopathic prescriptions or nutrition prescriptions. Conventionally, and scientifically, we have not seen that relationship. So we do recommend dairy, especially meats can be harder to eat during treatment. A lot of patients have an adverse taste. So it is encouraged to continue your dairy intake because of the high protein and calorie content it provides. Because I'm short on time, just letting you know that artificial sweeteners and organic foods are also okay to have. There's no research that shows that artificial sweeteners have had any result in growth of cancer in humans. Studies have been done in rodent studies, but we cannot relate that to humans. So everything in moderation is important. And lastly, the organic foods. There's no research that eating only organic foods can improve your survival rate or reduce the risk of recurrence. So I encourage you to look at the environmental working groups, Dirty Dozen, Clean 15, if you're interested in choosing more organic foods as you're able to. Next slide. The last couple of slides, I just am providing you some information on finding a registered dietitian if you're looking for nutrition advice or counseling regarding your cancer. There is a specialized certificate for dietitians who focus mainly on oncology. It is a CSO, and you can see that on this slide. And it's a board-certified oncology nutrition specialist, where you'll find that they're trained in understanding and working with patients that have cancer and undergoing treatment. Next slide. And the last slide here, we just have some information on resources that you can use to look up information, including recipes and up-to-date information on foods and cancer. And the last link at the bottom is regarding complementary and alternative medicine. If you come across something and you want to know what the evidence is, you can head to that location. And that's about it. So thank you very much.
Thank you so much, Rachel. I will now begin reading some of the questions that we have received during your presentation. The first question is, should patients drink water prior to eating to help with hydration?
Yes, that can be useful. If you're not experiencing any difficulties with eating enough or feeling too full with eating, you can certainly sip on water before you eat, and even more so to drink water throughout the day. Between meals is key.
Thank you. You had also mentioned protein supplements. What type of protein powders would you recommend, for example, whey versus soy?
I tend to recommend whey protein powder, most because it is more easy to digest, easily absorbed for most individuals, and also easier to find. You can find a lot of the whey supplements in almost every place nowadays. There's nothing wrong with soy. Soy is also a complete protein, so you can also use that for those who are vegan, because whey is made from milk products, and they both contain the same amount of protein.
Thank you. Carbonation usually or occasionally will bring on nausea or indigestion, but patients sometimes tend to prefer the flavors of a carbonated beverage. How do you recommend quickly decarbonating a drink?
Oh, that's a good question. I've not been asked that one before. I'm not sure if there's I can't say if there's a real quick way to decrease the carbonation other than letting the carbonation expire. But if you possibly buy a larger amount of the carbonated beverage and let that decarbonate over time, then you'll have a larger amount to drink when you want.
Great. Do you recommend taking curcumin? I'm not sure if I'm pronouncing that correctly.
Yes, curcumin has lots of benefits, and it's also often very talked about in terms of cancer prevention and how it's very beneficial in your care. And I think as long as you're using that in your cooking as a spice, that is fine. We just is encouraged to avoid taking them in large doses, especially if you're taking any kind of treatment or therapy, as they may possibly have some interference with the medications. Herbs and treatments have been looked into, but there's just so many variables with it that we can't recommend that you take larger doses as we don't know the effects, especially during treatment.
Would you recommend a fiber supplement during treatment or to manage diarrhea if the foods are not tolerable?
Sometimes I'll recommend a fiber supplement. It depends on the cause of the diarrhea, as I had mentioned earlier. Some individuals will find that Metamucil is helpful with helping to bulk up their stools. But again, I always encourage to try your hand at modifying your diet. And oftentimes, some of the treatments can cause the diarrhea, which can be more difficult to manage even with fiber supplements. So physicians will often still recommend like an Imodium, which is an anti-diarrhea, or Lomotil. But won't hurt, but I would suggest that you talk with your doctor or dietitian before you start that as well.
Okay, and sometimes multivitamins can cause nausea or stomach pain. How do you recommend combating this?
Especially, yes, that is correct. If an individual is already having some stomach pain or nausea, vitamin can also be difficult to tolerate. For those, sometimes if you're taking like Ensure, for example, or a nutritional supplement similar to, consuming 2 of those a day actually will contain all the vitamins and minerals you need. There are also chewable vitamins. There are options. For example, for those who have had gastric surgery or resection, I'll often recommend OptiSource, which is like a bariatric vitamin, but it's a chewable, easily digestible vitamin. You can also find chewable vitamins at a local pharmacy as well that are more easily digestible.
Thank you. And the last question would be, what nutritional considerations should be taken into account during the time of survivorship?
I usually will, during the time of survivorship, we'll review the guidelines from the American Institute of Cancer Research, which apply to all the individuals regarding maintaining a healthy weight, which is ideally a BMI between 18.5 and 24.9, and also making sure to consume at least 5 servings of fruits and vegetables a day. And you can find these guidelines on the American Institute of Cancer Research website. They're similar to the American Cancer Society recommendations as well. The other recommendations include increased physical activity of at least 30 minutes a day, at least 3 to 4 times a week, and limiting your red meat intake to, I believe it's no more than 18 ounces a week. But I even more so recommend that you have try to choose more plant-based and lean animal proteins like chicken and fish whenever possible. It is recommended to avoid alcohol. For men, it's no more than 2 drinks a day, and women no more than 1 a day, but even less can be encouraged. Outside of that, I believe those are the main recommendations. And if you have any concerns or questions, you can certainly contact me regarding this.
Great. Thank you so much.
Thank you.
As you know, this webinar was brought to you by Debbie's Dream Foundation, Curing Stomach Cancer. Thank you to Debbie Selman, President and Founder, our speaker, Rachel Wong from Medstar, Georgetown University Hospital, Lombardi Comprehensive Cancer Center, and to Genentech for providing funding that helped make this webinar possible. As you see on your screen, we have upcoming events to get involved in and support. Details about these events are available on the Debbie's Dream website at www.debbiesdream.org. Thank you to all of our listeners today. Our next nutrition webinar will be held on April 1st at 12 noon Eastern Time. We would love to hear your feedback, questions, and thoughts before then. Please send your comments to patient.resource@debbiesdream.org. Please stay tuned for the clinical trials webinar starting momentarily.